Hello everyone. For those of you who do know me, my name is Muhammad Arya Andika. As you can see on the screen, our topic today is about chronic disease. Today's topic is of particular is about of interest to those who want to know more about diabetes mellitus. Okay, it should take it about 10 minutes to cover these issues. Diabetes mellitus is disease in which the body does not control the amount of glucose, a type of sugar, in the blood, and the kidney make a large amount of urine. Prediabetes. Technically, this is not clinically recognized as a type of diabetes. The condition is thus characterized by blood sugar level are higher than normal, but not enough to be in the range of typical diabetes diagnosis. Type 1 diabetes. This form of diabetes is typically categorized as an autoimmune disease. With this type, the body's immune system malfunction and destroy attack insulin production beta cell with antibodies in the pancreas. The reason this happens is often attributed to genetic predisposition or faulty beta cell in the pancreas or environmental trigger, but the exact cause is not entirely clear. Type 2 diabetes. This form of diabetes most often develop gradually with age. Typically, type 2 diabetes is a bout of insulin resistance. It is also not yet fully understood why this happens in the body. The cells in the body become unable to use insulin effectively, and a resistance develops. The body's fat, liver, and muscle cell can take the insulin effectively, and resistance develops. The abnormal buildup of blood sugar, hyperglycemia, impair function in the body. And type 1 diabetes is cases 5 until 10%, risk factor unknown, and type 2 diabetes cases 90 until 95%, risk factor obesity, overweight, lack of physical activity, family history, and smoking. Next is causes of diabetes mellitus. Insulin resistant. Type 2 diabetes mainly result from insulin resistance. Insulin resistance may happen when cells in your muscle, fat, and liver don't respond as they should to insulin. Several factors on the condition contribute to varying degrees of insulin resistance, including obesity, lack of physical activity, diet, hormonal imbalance, genetic, and certain medication. Autoimmune disease. Type 1 diabetes and LADA happen when your immune system attacks in the insulin producing cell in your pancreas. Hormonal imbalance. During the pregnancy, the placenta releases hormone that cause insulin resistance. You may develop gestational diabetes if your pancreas can produce enough insulin to overcome the insulin resistance. Other hormone-related conditions like acromegaly and Cushing syndrome can also cause type 2 diabetes. Pancreatic damage. Physical damage to your pancreas from a condition, surgery, or injury can impact its ability to make insulin, resulting in type 3 diabetes. Genetic mutation. Certain genetic mutation can use MODY and neonatal diabetes. Symptoms of diabetes: feeling thirsty and hungry quickly, or polydipsia and polyphagia. Feeling hungry and thirsty quickly are the most common characterized experience by diabetes mellitus sufferers. In the body, food is converted to glucose. Diabetics have problem with insulin production or the body ability to produce insulin. As a result, the process of converting glucose into energy is almost hampered. Muscle pain and tingling neuropathy. This symptom in particular vary greatly from person to person. There are those who feel only numbness or tingling. However, all of this could be caused by nervous disorder due to long-term exposure to high blood sugar level. Frequently urination, medically known as polyuria, the refers to urinating more often than usual and is large amount. This happens because when your blood sugar level are high, your kidney work overtime to remove the excess sugar from your body, leading the increased urine production. Blurry vision. High blood sugar can damage the blood vessel in the retina, the light sensitive layer at the back of the eye. This can cause blurred vision, difficulty focusing, and even vision loss if left untreated. Identify your symptoms. Always tired? Yes. Always hungry? No. Sexual problem? Yes. Always thirsty? No. Numbness of hand and feet? Yes. Frequent urination? No. Symptomatic weight loss? No. Would that wound heal? No. Blurry vision? Yes. Vaginal infection? Yes. And World Diabetes Day infographic health risks. First, stroke. Second, blindness. Third, heart disease. Fourth, kidney failure. Fifth, loss of light, and more. Medical examination. The first one is intermittent blood glucose test. The purpose of this test is to measure blood glucose level at a certain hour, and there is no need to fast beforehand. If the result of the test show a blood sugar level of 200 mg per dl or more, then the person can be said to be positive for diabetes. The second, fasting blood sugar test. This test aims to measure blood glucose level under fasting condition. So patient must fast for 8 hours before taking blood sample. If the fasting blood sugar test results show blood sugar level of less than 100 mg per dl, then blood sugar level are still normal. However, if the blood sugar test results are between 100 until 125 milligram per dl, then the person is experiencing a condition called prediabetes. Treatment. How to prevent diabetes? The type of diabetes diagnosis will determine the most effective treatment plan, which may involve blood sugar monitoring, oral medication, and insulin. Treatment applicable to all type of diabetes. Healthy eating pattern. Diabetic can benefit greatly from nutrition food high in fiber, like fruit, vegetable, and whole grains. Physical activity. Exercise increase a person's sensitivity to insulin, so the body requires less sugar to transport sugar to cell. Specific treatment for type 1 and type 2 diabetes. Monitoring blood sugar level. A diabetic can check their blood sugar level several times a week or as many as 4 to 8 times a day. Insulin therapy for individuals with type 1 diabetes is critical for survival. Transplantation. Pancreas transplantation is sometimes a treatment option for people with type 1 diabetes. Bariatric surgery. Individuals who also have a BMI body mass index higher than 35 and type 2 diabetes may benefit from bariatric surgery. Management of diabetes mellitus, preventing or managing diabetes. The first, adopt a healthy lifestyle. Implementing a lifestyle for diabetes sufferer at a young age is simplest way. Some actions that must be taken are consuming healthy food for diabetes, exercising regularly, getting enough rest, and eliminating the habit of smoking. And second, insulin injection. For people with type 1 diabetes, insulin injections are the main medication because their bodies are unable to produce it. And the third, consuming certain medication. The regulate insulin and deal with spike of blood sugar. Doctor may prescribe drugs such as metformin for people with type 2 diabetes. Meanwhile, giving medication to people with type 1 diabetes is intended to protect important organs such as heart, kidneys, and liver from damage. And the last steps for living better with diabetes. The first, eat healthy. Second, be active. Three, monitor. And fourth, medication. That's all I've got to say. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.